Nasal Alzheimer's vaccine to start human trials. Interestingly, Brigham and Women's Hospital in Boston, Massachusetts will before long start phase I preliminaries of a nasal immunization intended to forestall or slow the movement of Alzheimer's illness. An official statement said, "This is the important occasion when a nasal neutralizer is being attempted for the disease, which impacts more than 6 million people in the U.S. alone." First found in a patient way back in 1906 by Dr. Alwa Alzheimer, the infection is a mind problem portrayed by the presence of bunches, amyloid plaques and tangled strands, tau tangles between nerve cells, neurons in the cerebrum. Side effects of the infection, which are typically found in grown-ups in their 60s, differ from memory issues to vision misfortune and surprisingly impeded thinking. The reason for the infection has for quite some time been addressed, and specialists as of late accepted to have gone to its foundation. Research for a fix has been progressing for quite a long time. Be that as it may, most intercessions are pointed toward diminishing the seriousness of the indications. The immunization to be tested intends to change this. The nasal vaccine trial. Howard L. Weiner, co-overseer of a middle that concentrates on neurological illness at Brigham, has been investigating the improvement of AD for north of 20 years. Past investigations have shown that the resistant cells in the body assume a part in the expulsion of the amyloid plaques from the mind. In this way, the scientists are utilizing a resistant modulator considered Protolin to invigorate the invulnerable framework and eliminate the plaques. Protolin is an intranasal specialist inferred by blending explicit cell parts of various microorganisms and is now utilized as an adjuvant to produce more prominent resistant reactions for different immunizations. The experts are sure that by setting off the invulnerable structure, unequivocally the white platelets from the lymph center point arranged in the neck area, the counteracting agent will get out plaques in AD patients as well. The preliminary will incorporate 16 members between the age of 60 and 85 years who have been determined to have suggestive beginning phase AD, the official statement said. Preliminary members will get 2 portions of the immunization, multi-week separated. The principal point of the preliminary is to decide whether the immunization is protected and can be endured at the measurements arranged. If effective, a similar method of treatment could be utilized for other neurodegenerative illnesses, the public statement said. Strangely, one more conceivable treatment and immunization system for AD was distributed recently and will move to human preliminaries soon.